COVID-19 patients with the most severe symptoms are admitted to the hospital. But as soon as they're out of danger, they're sent home. Local coronavirus patient Kevin Harris is recovering at home now after sharing his unhappiness with being discharged recently. In this First News follow-up, reporter Carolyn Sistrand learned what life is like after being in the hospital for the virus.
People who contract COVID-19 can have a range of symptoms. Some feel fine and others find themselves in intensive care, which is what happened to Warren resident Kevin Harris. He was the first confirmed case in Trumbull County and the 5th in the state. Harris is now home in isolation.
So now I'm like bedridden, but I'm not sick with the virus bedridden. They tell me I'm going to have a 2-month recovery and I may have permanent liver damage, permanent lung damage.
Harris says he's improving now, but says he was worried when St. Joe's Hospital in Warren discharged him after 13 days. He says he felt really sore and was very weak. Dr. James Kravick works at Mercy Health in Youngstown and says that while patients may not have fully recovered, sometimes heading home is their best option.
You really don't want to be in the hospital longer than you medically need to be. Other bad things can happen if you're in the hospital too long. You should go home and be in isolation.
Kravick said doctors follow guidelines from the Center for Disease Control when they discharge a coronavirus patient. The things they look for can differ based on medical teams and conditions of specific patients.
Improved oxygenation level, less shortness of breath, improved labs, improved imaging studies. So there's really no absolute guideline for when someone is to be discharged.
Kevin Harris says the problem with his discharge was communication at the time. He did not feel physically prepared to leave, and he said his home was not properly prepared for isolation. But Harris said he does understand the situation hospitals face, knowing that the number of cases may only grow.
They're going to get you in, get you stable, and get you out so they can get on to the next person. And I get it. With all the stuff I've heard from around the world, I get it, and I don't have a problem with that. I can recoup at home. It's just, I'm going to have some issues for a couple of months.
Carolyn Sistrand, WKBN 27 First News.